Can you do the surface marking of liver on this volunteer?
Yes, sir.
Do it.
First, for the surface marking of the liver, we need to consider 3 borders: upper border, lower border and right border. First, let us start with the upper border. For the upper border, we have 3 points. The first point is just below the right nipple, which corresponds with 5th rib. So, we need to take the first point of just right below the right nipple.
Ribs should be counted as a rule from?
Sternal angle.
So you need to count from sternal angle, which should coincide with second, then third, fourth, fifth. Like that, you should come to here. Okay.
5th rib. This is the first point, which is just below the right nipple, corresponding with 5th rib. This is the first point of upper border. Next is the second point. Second point of the upper border is a xiphisternal joint.
Feel for it, xiphisternal joint here.
Here is a xiphisternal joint. So this is the second point of upper border. Next we have the third point. Third point is just below and medial to the left nipple, which corresponds with 5th intercostal space.
Very here. Okay.
Now join these 3 points with a convex or concave or convexity.
This represents the upper border of the liver.
Border of the
Over
liver.
this lies what?
A right and left cupola of the diaphragm.
Here?
And here we have a central tendon of diaphragm.
Okay.
This is the upper border of the liver. Next, we take the lower border of the liver. Lower border of the liver has 4 points. The first point is 1 centimeter below the tip of the 10th rib. So,
okay, tip of the 10th costal cartilage, 1 centimeter below.
1 centimeter below the tip of the 10th costal cartilage. It's here, 1 centimeter below. It is the first point. And second point, it is tip of the 9th costal cartilage. To mark the 9th costal cartilage.
Okay, you mark the tip of the 9th costal cartilage. You mark it on this here.
Here, it is the 9th costal cartilage.
Next point
Next,
is?
we have third point is transpyloric plane.
In the midline.
In the midline.
So transpyloric plane coincides with this only.
Yes, 9th costal cartilage.
Mark a line. That is transpyloric plane. Okay. Next point is, third point you would like to take is?
Third point is along the midline at the transpyloric plane we have
Mark
third point.
Then?
And next we have fourth point. The fourth point is the same as that of the upper border's last point, that is just below and medial to the right nipple, corresponding with 5th intercostal space. Okay. Now we'll join these 4 points.
This represents the
lower border of
the liver. Then what is left over?
Right border of the liver. Right border of the liver is drawn by joining both the edges of the upper border and the lower border of the liver. So now we will join with the convexity, curvature, convexity, joining both the edges of the borders, upper and lower border of the liver.
So what is this plane here? Transpyloric plane.
This is a transpyloric
What are the
plane.
events occurring there?
The transpyloric plane corresponds with the fundus of gallbladder, pylorus of the stomach, origin of superior mesenteric artery, termination of the spinal cord, and we also have first part of duodenum.
Pylorus of the stomach.
Fundus of gallbladder.
Hilum of kidney.
Hilum of the kidney.
Termination of spinal cord and origin of superior mesenteric artery. What is liver?
Liver is the largest gland in the body. It is a
is it a mixed gland or exocrine? Or
it is both endo and exocrine.
Predominantly
exocrine.
What it secretes?
It secretes
bile.
Bile.
Okay, good.
Thank you, sir.